So this is a tough act to follow, right after Dr. Mohan Reddy. Garu, thank you very much. Please give him a big round of applause for actually bringing this whole act together. Without his vision, I don't think I could have been here sitting down. And Jayasri Garu also, who has redesigned this. And I want to thank my team and thank you all for 9 o'clock. You're still here sitting. And I promise you I'll finish this very quickly. I just want to see a raise of hands. How many of you think OSA reversal is possible medically? Surgically, he'll take care of. I don't need to worry about surgeon. I'm not a surgeon. But medically, he deals with the surgery. It's his job. But medically, and there is so much published evidence and so many clinical trials done that you can do it. So I was a family physician, geriatrics and hospice palliative medicine. I was a program director. I left the University of Toledo in 2016 and I wanted to create what is called health care, not sick care. Because you all know, right, dealing with geriatrics, 65 years and above, hospice is you're dealing with dying patients. So I've seen disability, frailty, but I wanted to do health care and I wanted to say patient is the boss, doctor is the coach. And you might be wondering why behavioral person is important in this whole game. Because everybody knows knowledge now. You can use AI and get all the information. But how do you change behavior? So there are 5 stages for change called pre-contemplation, contemplation, action, maintenance, and relapse. So in the pre-contemplation and contemplation, a human being needs what is called motivational interviewing. And then in the maintenance phase, life is all good. But it's when relapse happens, because you all see diets work for a while, but then they go back to their habits. The reason is because habit formation is what we are trying to, and I'm going to kind of surprise you that our Indians have pioneered this 3,000 years ago. And here we are looking at lifestyle medicine from America trying to tell us how to do care. I'm both certified in longevity medicine, anti-aging, but I blended both lifestyle because you have 6 pillars in lifestyle medicine: exercise, nutrition, stress management, sleep, addictions, and social relationships. There are 9 hallmarks for aging. But what I wanted to kind of emphasize is that what happened? Is that okay? Oh, it's gone? What happened? So basically what and then I kind of, so let's take this off. Is that okay if I, oh. Right? So, thank you. So if you can see, as you all know, for the non-doctors here in this room, systematic and meta-analysis mean that they look at all the research that is published. They all they all put together the apples, the peaches, or the grapes, all they divide it, and they kind of really put a lot of science to find out what exactly is the answer. And they actually help you. It was done in weight loss and lifestyle interventions can actually change. You can see how many studies, 1,420 participants, the apnea-hypopnea index, the oxygen saturation, daytime sleepiness, they all have improved significantly. And the way we do it is through lifestyle medicine. But what are the drivers of chronic disease? So if you have inflammation, he has kind of mentioned it, insulin resistance. What's inflammation? It's not what you talk about when you get an injury. That's an acute inflammation. But here I'm talking about chronic inflammation. Every day now you're eating something, you're drinking something, your body actually is inflamed. And from there, healing happens. But if it is persistent and it gets into low grade, then it's called inflammaging as you age. And that's the cause. Because once you are inflamed, a lot of inflammatory markers come out, and then they cause insulin resistance. They change, cause heart disease. Because people think blood pressure is because of high elevation of blood pressure, right? 120 and 80 above. But there are three mechanisms that actually happen in the blood vessel, which is inflammation, oxidative stress, and autoimmune dysfunction. So that's the reason I put together the 8 drivers of chronic disease. So chronic low-grade systemic causes airway inflammation and drives OSA progression. Insulin resistance. I don't need to do a lot of tests, but if for academic reasons, there is what is called HOMA-IR that you can do. In the interest of the time, I'll cut down, but you can just check. If you have this belly here, then you have insulin resistance. And when you have insulin resistance, where do you get the insulin resistance? Can anybody say, why do you get diabetes? What's the cause? Why do you get diabetes or pre-diabetes? Anyone? What do you normally hear your doctors telling you? Stop eating a lot of rice, right? Which is carbs. Diabetes is because of fat. Each gram of fat gives 9 kilocalories. Carbs and protein give 4 kilocalories. When you add more calories to your diet, so what happens to the rest of the calories after you spend what you need? It turns to fat. And where does it go? Here, here, in the armpits, in the belly. So the problem is in the thighs. So this is the visceral fat. So it's the visceral fat that's more important in obstructive sleep apnea that causes the insulin resistance. And when you have more fat, then a lot of inflammation happens. Where do the toxins go and stay? In the fat. So and then they cascade more inflammation and then more swelling. So it's very important that you go to the root cause. That's what lifestyle medicine, longevity or functional medicine is. Toxins. A lot of people think heart disease is because you have a high cholesterol and you get heart disease. Just living in Delhi, because you inhale the 2.5 parts per million particles, you actually lose 8 years of your life. So pollution, there's toxins. And toxins, you can see VOCs and environmental exposure exacerbates airway inflammation. I just saw a patient today who has a lot of inflammation in his lungs, and the point is you have to reduce the underlying inflammation. So in India, I've never seen, but I have used a medication called naltrexone. So when naltrexone is used for 25-50 milligrams, it's for alcohol and drugs, addictions. But I use in America below 6 milligrams. We call that low dose naltrexone. I don't have that in India, but I still try to monkey around with 25, cutting it to quarters and all. But these are some of the things that in a holistic approach we use. Below 6 milligrams, it is a very strong anti-inflammatory agent and immunomodulatory. Because once you have inflammation, autoimmune sticks in. I'm sure you all have heard, once you have arthritis, then, you have thyroid disease, like hypertension, cholesterol, heart disease, diabetes, stroke. These are all the cascade of events, but the underlying root cause is the inflammation, autoimmune dysfunction, and the oxidative stress. And then hormones. When you have a lot of inflammation, your thyroid gets changed, reproductive and metabolic hormones. I just saw a patient who is right in this room, but his hormones were checked. He can't sleep. So in a holistic approach, what we do is we give him magnesium glycinate, which is a wonderful muscle relaxant, and you sleep well. And then his progesterone was less than 0.3. A man also needs progesterone. There are progesterone receptors in the airway. There are estrogen receptors in the airway. Even a man needs all these things, but we think it's only testosterone. His testosterone was normal. But I put him on progesterone because progesterone helps to sleep. It could be that that's his main cause, despite all the surgical issues. I'm not saying, but I'm guessing. I'm just saying I measured, and in a holistic approach, this is what we do. How many of you people know gut problems actually cause sleep apnea because it leaks. I check gut microbiome, and there is significant research that if you fix the Firmicutes bacteroides ratio, which we can check and reverse it, and reduce the systemic inflammation, which Dr. Reddy already said that is one of the key causes. But how do I reduce? I'm an Indian, right? I want cheap stuff. I don't want to give supplements, trying to give probiotics, prebiotics, all these medications. Eat a lot of fiber. Where do you get fiber? Plants and vegetables. So stem cell dysfunction, when you have a lot of oxidative stress, and the same patient I'm talking about, because that Dr. Reddy has mentioned, his ACTH was like 23 when the upper limit was 12 because his prolactin was elevated. When somebody is stressed, these two hormones go up. So that impairs the stem cell dysfunction, and then you can't repair yourself. Mitochondrial dysfunction, when you have repeated hypoxia, you have fatigue. That's caused, then they don't sleep, early morning they have fatigue. So when genetics are affected, then because we call that DNA methylation, which is the MTHFR gene, and that causes changes in metabolism, airway genes also as well, and you can reverse this with therapy. When you age, your genes reduce in size. We call that telomere shortening. Can you answer one thing that is simple and our sages have done that helps prolonging of the telomere or the genes? There is no pill here. You don't have to spend any money. It's called meditation. When you meditate daily, your telomeres prolong. So our Indians have figured this out thousands of years ago, and I call that Ashtanga Yoga. You all heard of it, right? Patanjali Yoga Sutras, Yama, Niyama, Asana, Pranayama, Pratyahara. These are all about bringing health to your life. Dharana, Dhyana, Samadhi are about happiness. So you need all these 8 things. 3000 years ago, Patanjali said how to lead your life. So I'm taking those to create habits to cause health transformation, because those were designed for cell transformation. So now I'll show you real data, how inflammation affects. It drives the disease progression, causes cardiovascular complication, and when you actually do CPAP and lifestyle, reduce inflammation and improve outcomes. So sleep. If you don't sleep by 10 p.m., it's very difficult for you. 10 p.m. to 2 a.m. is when your body regenerates. It rejuvenates and restores itself. If you can't sleep by 10, you're losing because it doesn't detoxify. What happens if your toilet is blocked? It stinks. Same way your body, if you don't sleep by 10, it causes inflammation and causes the problems, which I didn't know as a family doctor. I went to lifestyle medicine course, and that's how insulin resistance, because of lack of sleep fragmentation, because there is sleep fragmentation, it causes insulin resistance issues even in non-diabetic patient. Today one of the patients said, I don't have diabetes. I said, that's fine, but you have insulin resistance because insulin was high. So in holistic approach, we check the insulin. We don't wait for a hemoglobin A1C or fasting diabetes. Once you have elevated insulin, that's a disaster. And insulin resistance diabetes actually cause OSA risk to go up. Hormone, I told you, progesterone and estrogen stabilize the airways, explain the gender differences. So if you don't have progesterone, you could be causing, sorry about that. So testosterone also affects across the lifespan, and thyroid. Some people will have elevated thyroid antibodies but have normal thyroid function. In a holistic approach, I give them 3 things to do. I fix their gut, I take them off the gluten, and I put them on naltrexone, and that changes the game. I've reversed my thyroid antibodies, but my CRP went down. So the point is, you have to look at hormones as well. And the gut-brain sleep axis, it's huge now. Have you heard of this, ENT doctors, the gut-brain sleep axis? It's being really talked about a lot now. Gut-brain sleep axis, gut-heart axis. So every disease, your gut has a, so when you see in obstructive sleep apnea, the firmicutes bacteria ratio is increased and there is neuroinflammation and metabolic dysfunction. So when we do a lot of fiber, sleep hygiene, probiotics and prebiotics. So in my patients, I ask them to stop looking at the phone at 8 o'clock. 8 to 10, they have a bath, do yoga, pranayama, they actually walk if they want to. And one best way and easiest way to reduce your insulin resistance is to walk after each meal. You can check, you can put your continuous glucose monitor or check your glucose before and go for a walk after you eat. Like you ate now, check your sugar, go for 30-minute walk, come back and check it. I guarantee you it will drop. It doesn't matter which kind of exercise, but walking, but if you do even more, you actually, these are simple tricks that we use to reduce sleep insulin resistance. Mitochondria is very helpful because of the hypoxia. The mitochondria are damaged and they have cognitive impairment, and we use antioxidants. What is the best way? As far as I am concerned, you should eat a rainbow color of foods. If you like dondakai, you can't eat dondakai every day. You got to eat beetroot, carrot, apple, pomegranate, berries, if you get it here, but colorful. So what did Ayurveda teach in the past? Based on the seasons, they created what is called Vata, Pitta, Kapha, based on that each season, and they talked about eating the seasonal and growing locally vegetables, because that influences the gut microbiome. Our Indians, then they did what is called fasting. Stem cells, when you fast, for cancer patients, it's the best thing to do, because it creates autophagy and stimulates stem cells and kind of helps in their recovery. But we have figured that out. So I tell my patients, based on what I understood, these are the 6 poisons. I don't know how many people will like it, but I make sure that they follow. I forgot the paper, but I'll be happy to leave it here, send it here, and you can give it to everybody or email it. My patients, everybody must stop processed foods. You eat the produce, not the product. No processed foods. They all have chemicals, and when you eat, body doesn't know anything but to create inflammation. Potato is good, but potato chips are bad unless you air fry them. So processed are a disaster. Sugar is very inflammatory. I'm an anti-aging and regenerative medicine. If you have a tennis elbow, I use dextrose water with lidocaine and I inject here, and tennis elbow is gone. I heal ligaments by it's called prolotherapy. If that doesn't work, then I add peptides to it, then I do. But the point is, sugar is inflammatory. And how many times we drink tea in India? Quite a lot of times, right? 1 by 2 chai, lot of times. And then we eat maida, Usmania biscuits. So refined flour is a disaster. Please, naans, disaster. You don't have to do anything. Just eat these things, you'll create inflammation. And you'll change the insulin resistance. Processed food, sugar, refined flours, dairy. Why dairy? It was nice and pure in the past, but now everything's hormone. In US, every cow has a pellet. They have hormone pellets. And for the udders, they all give antibiotics to prevent infection. So all the milk gets tested for hormones and antibiotics. But if you just think, why is milk there in the first place? Nature gave. It's to give all the growth factors, like insulin growth factor, which is like you feed cancer if you give insulin growth factor. Sugar creates insulin growth factor. That's why sugar is a disaster in cancer patients. So the point I'm trying to make is, milk was designed for the calf, not for human consumption. But we have made it so that it becomes, and then on top of it they add oil. So processed food, sugar, animal products. Why I don't like animal products is not because I was a vegetarian from my child. No, I was a non-vegetarian strictly 3 times a day. But when I learned at Harvard for a 5-day course, when you eat meat, it causes 3 things. TMAO. TMAO takes cholesterol and puts it in the blood vessel. Heterocyclic amines and activated glycated end products. These 2, they cause cancer. How many of you have heard that we are having rise in cancer and heart disease? And that's your answer. Because when I was a kid, we used to eat on a Sunday, and it was a joint family. You hardly got 1 or 2 pieces. Now you don't need to. You can get your half chicken. So that's your problem. So meat, animal products, dairy, refined flour, gluten. Gluten was, wheat was good until we had a famine and a university guy from California did genetic mutation to the wheat. And then that changed the game. Now India, I heard, they're going back to the original seed. But the problem is, try this on your own self. Processed food, sugar, animal products, dairy, refined flour, gluten. You stop all these 6 things and see what happens. But I don't want you to become restrictive. Lifestyle medicine is not restrictive, it's inclusive. So when you stop animal products, eat whole food, plant-based. Indians were given millets, eat millets. You can soak millets for 12 hours and cook it in the next morning, it will taste great. Instead of animal product, eat lots of fruits and vegetables. People think you get diabetes. They have done prospective studies, like looking forward 19 years, giving diabetic patients both type 1 and type 2, lots of fruits and vegetables. And it didn't really do any macro or microvascular complications. Yes, the sugar will go up. I will agree that. Mango will go up. That's based on the glycemic index of the food. But the point is, animal products are much more disaster than this for diabetes patients. If you want to reverse your diabetes, 3 things. Give up all the animal products. Give up all the oil. And eat as many fruits and vegetables. I have a lady here who said she followed these few things and lost 4 kilo, even without seeing a doctor. And I have reversed psoriasis completely with just stopping those 6 things and following lifestyle. Smoking and alcohol are a disaster. Epigenetic changes. Lifestyle medicines reduces epigenetic, because in stress reduction, I ask people to meditate. In stress reduction, it doesn't have to be, everybody has to become a saint. You need to start doing activities that you don't know or you love, and then it becomes, so biological aging is actually better when you actually reduce the inflammation, take care of the airway function. So we use what is called a whole food plant-based diet, and that's what you're going to eat today. Sleep by 10 p.m. Make sure that you use glass bottles. Plastics are a disaster. And movement is medicine. Do mindfulness and have good social connection. In India, social connection we definitely have better than Americans, but here also, based on your state, based on your caste, if you get together, that's not social connection. Social connection is when you wake up, how you treat the next human being, how you treat the environment, how you treat the animals, how you treat the plants. This is what is your social connection. And UK, actually, when you walk in nature, if I write a prescription, the UK people will actually pay the employer, because just walking in the nature reduces anxiety and stress by 25 to 30%. It's called nature walking. So these are all things that our people have figured out. Weight loss, which one actually causes, you can see here, CPAP only gets to you certain extent, weight loss to certain extent, but intensive lifestyle creates a large portion, and that's what our collaboration is all about. And he can take, and whole food plant-based diet is really the key, and the best way to do it is weight loss plus multimodal approach, wherein you have to have behavioral approach. That's why we have a team. And I want to kind of address that you got to address all these 8 pillars, and that's my job. And these are all the clinical trials. Mimosa trial that was seen in 187 overweight, and they actually reduced for 6 months. They literally reduced sleep apnea, and you can see the outcomes, so they reduced daytime sleepiness, decreased insomnia, increased, and it was p-value was less than that. In interest of time, I'll kind of say these are all the interapnea trials, CPAP free by this 62% in 6 months. So you can literally get out of CPAP machine. And sleep ahead studies, another research study, average weight loss 7 and 76% reduction in risk reduction. So in our approach, we try to promote the lifestyle modifications by addressing the 6 pillars, but if in case they can't lose, I use definitely weight loss injection, GLP-1, there is new research and data that you can actually do, and this is a sleep ahead study, 10-year follow-up, that they have shown that you can sustain by changing the lifestyle, and this is how we can help patients lose weight in a holistic approach. These are all the data, and the more, the power trial is a good one again, that the clinical outcomes are significant in both cardiovascular and obstructive sleep apnea. But we do labs for all these 8 drivers, and based on that, I address, and we actually create a chart, then NOVA forms are filled, I review them, we create, so like you all doctors will give prescriptions, in lifestyle medicine we call them SMART goals, specific, measurable, achievable, realistic and timely, and we give them for the 6 pillars fit prescriptions, frequency, interval. We don't just say go and eat less carbs, we'll specify what you must eat, and that's what Supraja does based on, and Sirisha will do, and I review the patient, and then I would like to kind of have, and then follow up with, we do all the things, and probably the way we can transform is from sick care to health care is by doing a holistic approach. Are you speaking? 9:30. Okay, so can you just briefly tell your experience?